As treatment options in hemophilia B continue to expand, many patients find themselves facing an unfamiliar challenge, not a lack of choices, but an abundance of them. Dr. Stephen Fein is a Johns Hopkins and Duke trained board certified hematologist. He's the founder of Heme on Call and leader of benign hematology services at Amplify MD, where he works with patients from across the country seeking specialized care and second opinions for bleeding disorders and other blood conditions. Because his practice is built around telemedicine, Dr. Fein has a unique view into the questions patients are asking, the decisions they're weighing, and the information they're seeking as they navigate today's rapidly evolving treatment landscape. In this conversation, we'll explore the value of second opinions, shared decision making, and what patients can do to feel more confident when facing important healthcare choices. You've heard us talk about Zebra for Care before on BloodStream. Dr. Fein is a major part of that platform, and he joins me now. Dr. Fein, welcome and thank you for being here on the BloodStream podcast.
Thank you for having me.
So we gave a little bit of your background there in that introduction, but before we jump into the world of hemophilia B and the work you're doing today, what would you like audience to know about your background and hematology practice in general?
Yeah, I started as a benign hematologist focused on clotting and bleeding disorders, and really focused on raising awareness and attention for people who have rare hematology disorders, including hemophilia B, but also all the other rare hematology disorders like autoimmune hemolytic anemia and ITP. And I wound up finding myself interested in expanding access across the country. Turns out there are only about 300 benign hematologists in the whole United States. So by expanding access and expanding to telemedicine access, I've been able to bridge the gap for people who need access to benign hematologists.
Interesting. And you speak with patients from across the country, given that you are telemedicine. Why are people with hemophilia B seeking second opinion telemedicine consultations? Why is that happening right now?
There are several reasons. One is that they want reassurance to know that the treatment they're getting is reasonable. And this spans the range of people who have severe hemophilia B versus those, and also those who have milder hemophilia B that only need intermittent treatment, or maybe they just need to know about treatment options. A whole separate reason for people to seek a telemedicine hematology consultation is that they don't really feel connected with their local HTC or their local physician. A lot of times they're seeing a hematology oncology provider who's not quite the expert at hemophilia that the patient is looking for. Now, and important to realize that there are now several treatment options for these patients, and they're just looking to get information from whoever can provide it, from an expert who at least can explain the treatment options.
And do you find in general, are patients looking to change treatments, or are they mainly seeking reassurance that their current treatment is appropriate?
It's both. So change treatments, sometimes we find people who are just not on any treatment and they're looking to start something and figure out what there is for them. And it's partly this disconnect that they may have with their current provider. But those who are actually on treatment are looking to find out whether they can be optimized, whether they're doing the best thing that they can, and sometimes looking to at least explore other treatment options.
And we've seen remarkable advances in hemophilia B treatment over the last decade. From your purview, what's changed the most?
Yeah, the top thing is the extended factor products. That's really changed the world for all the hemophilia, all the bleeding disorder patients, hemophilia A and hemophilia B. Extended half-life products, which came simultaneously with gene therapy, have made it so that patients can have a better quality of life without joint bleeding and living on prophylaxis. Now, it's not perfect for everybody, and it turns out it's not fun and games to do self-injection and have, even with extended half-life factor products, but it has definitely made life better and probably prolonged the lives and definitely prolonged and improved the quality of life for patients with hemophilia B. In addition, gene therapy has finally come of age, and gene therapy is now an option for selected hemophilia B patients, offering the potential for a sustained increase in factor IX and to possibly come off of all factor treatment. It's not an option for everybody, but it's becoming more widely appreciated, and it's something that's worth talking about.
I agree. It is worth talking about, Dr. Fein, and I'm going to use that as a cue to take a moment here to remind listeners about Zebra for Care. So if you're living with hemophilia B and want to better understand whether you may be a candidate for gene therapy, Zebra for Care offers a free online self assessment designed to help you prepare for that conversation. After completing the 5-minute assessment, you'll receive a personalized report that you can bring to your next visit with your hemophilia treatment center or hematologist, helping make that shared decision making conversation even more productive. You also have the option to share that assessment with Dr. Fein and his colleagues through Amplify MD to request a second opinion consultation. Now, for me personally, getting a second opinion was an important part of making a major health decision regarding ankle surgeries I needed from years of damage related to my hemophilia. The second opinion is what gave me confidence that I understood my options and was making the decision that was right for me. And that's really what Zebra for Care is all about, helping people with hemophilia B feel more informed, more prepared, and more confident as they navigate important treatment decisions. So to learn more or complete your free self-assessment, visit hematology.zebraforcare.com. Again, that's hematology.zebraforcare.com, or simply follow the link in this episode's show notes. Okay, so Dr. Fein, back to you. I want to ask you a question about these treatment options and their availability. I just mentioned shared decision making. How do you, on your side of that conversation, come to decisions, conclusions about which treatment option is right for a particular patient? What information are you using to come to those sorts of decisions?
Yeah, it's more complex, but also so much more rewarding now because we have options. And there isn't a single best treatment option for everybody. We have to look at all the factors. We look at all the issues, rather, factors, pun.
No pun intended, of course.
So we look at the history of bleeding, the history of compliance and ability to get clotting factor and prophylaxis and to maintain good quality of life on factor. We look at the actual factor levels. We look at the patient's history of joint challenges, joint problems, joint pain, their age and activity level, whether they want to be active and do sports and activities, whether they want to actually be able to work out and do exercise, whether they travel, their ability to get treatments if they actually are mobile and don't stay in the same place to have them access to their treatments coming to their home. We look at their personal goals and what they want to achieve on treatments and whether they're looking to try for a treatment option like gene therapy that might be a one and done versus their contentment with extended half-life treatments. We like to expose people to all their options, including a discussion of gene therapy as an option. Now, no two patients are identical. Everybody's got a different profile of their needs and patterns and desires and ability to get access to different treatments. That's part of the reason for the whole shared decision-making concept, to be able to go through this in detail with the patient. And we do this online, just to be clear about the telemedicine. So it's a second opinion as a telemedicine appointment. So it's not traveling. They see us from the comfort of their own home, commonly with their family, either next to them or on the same call, like a video call. And commonly evenings or even weekends that we do this. And we're able to give the second opinion and go through all this.
So speaking of telemedicine, how would you say telemedicine has changed access to expert hemophilia care?
The main thing is it's changed access to actually seeing a hematology provider, which is myself as a physician. We have many APPs, nurse practitioners and physician assistants doing this together, and others who are pertinent to this. And the access to seeing and talking to somebody, because really all this starts with conversations and education. And you don't need to travel 20 or 50 miles or longer to actually just have a conversation with an expert. Now, that's the telemedicine world we're in. And we're way into this world. This is not new anymore. We've been doing this for now many, many years. We see you online. It's just like a regular doctor visit, but it's online without physically going to the doctor's office. And commonly we're on time without making you wait too long. We try to be. And that's not easy, but we try to be so that we don't make you wait too long to see us, and make it so you can get seen faster. You don't need to wait months to get an appointment. So that's the revolution of telemedicine for hematology. Hematology turned out to be one of the best specialties in medicine for telemedicine, because most of what we do is reviewing your situation and doing education and even showing you some things online. We can share a screen and show you your numbers and go through your test results and other things online. So hematology is very telemedicine friendly. When it comes to actually getting the treatments, our team has connections with pharmacies, and we know how to access the pharmacies, and we know how to have things sent to you. So just hemophilia B patients are aware of having treatment sent to them. That's something that we're in the mix with, and we're able to help out with that. So you don't have to physically go somewhere to get things sent to you. And when it comes to gene therapy, that would be a referral to a gene therapy expert and physically going there and getting the treatments.
Makes sense. Dr. Fein, some patients might worry that they'll offend their doctor if they seek a second opinion. What are your thoughts on that particular concern?
I view it the opposite. I think that most hemophilia providers and doctors are happy to be part of the larger picture network of discussion and education about hemophilia. And it shouldn't be viewed as that we're stepping on anyone's toes or that you're going to offend them. It shouldn't be viewed that way. Yes, it's true that some doctors do get offended. And I think we second opinion providers have to be careful that we don't step on their toes. And we explain to you how you can talk with your other doctors about you got a second opinion. So what? That's a common thing to do in medicine when you have a challenging problem. Now, we're finding that most of the patients who come to us are not thrilled with their current doctor or their current situation. So it's not so much about stepping on toes of someone that you trust. Oftentimes it's actually just getting another opinion and possibly getting another provider long-term. It's all about you, the patient, to get the confidence that you need to make well-informed decisions. And it's not only your right to get a second opinion, but also something that will empower you and make you feel better about everything.
Speaking of patient empowerment, Dr. Fein, we've discussed shared decision making a little bit, but when thinking about an important healthcare discussion between a patient and their physician, what can patients do to prepare for those moments? They're so important. How can patients best prepare for them?
Yeah, they should be comfortable with the kinds of questions that we're going to be asking for a hemophilia patient. What's your bleeding situation? Have you had a breakthrough bleed? Maybe try to document it and keep a diary in your phone even, just so that we can have an easier discussion about it. So you're not thinking back, did I have a bleed or not? Think about the pain level that you have and what joints are hurting. Think about whether or not this is interfering with your daily life and your quality of life. And you should be able to have an honest discussion about what treatments you have had success with, how well it's gone, how easy it is for you to actually get the treatment, how challenging it has been. Would it make a meaningful difference to you to get onto extended therapy or to try to have a discussion about gene therapy so that you can have a one and done and no longer need this infusion therapies? And so be prepared with the right questions. Be prepared with kind of, I would say, a diary of what's gone on with you the past month or 3 months so that we can have a better discussion about it. And the other thing to be prepared for telemedicine for me, for the way I see it, is that this should be a recurring thing. So it shouldn't be like a once a year check-in. Telemedicine makes it easy to do an every 3 or 6 month check-in if you were to stick with the telemedicine team and not be a single second opinion appointment. So just to point out that we can do that a little more easily to do a frequent appointment without having to drive to us, and we can see you every 3 or 6 months. And I think that gives you a little more stronger bond and relationship with the team, which not just a second opinion team, but a care team that's online.
And Dr. Fein, you mentioned coming in prepared with questions. I think sometimes for patients, it can be hard to know what questions to even ask their healthcare provider. And sometimes I know in my experience, those moments can feel intense or overwhelming, and I can totally lose sight of what was previously on my mind. How do you advise patients on how to come up with the questions that they ask their provider about new treatment options?
The questions are, will these new options be appropriate for me? Or are they appropriate for me? Are there benefits that I can expect to receive by taking a new treatment option that would outweigh any risk or problem or challenge with them? So do the benefits outweigh the risks? How will this possibly improve my quality of life? A big question is, do we know the long-term outcome or effect of any of the new therapies? Is there any problem that we anticipate down the road? And then another question is, what kind of monitoring will I need to be on? As an example, gene therapy, we know we have to do a liver enzyme test every so often just to double check that there's no problem with it. So we do that. And that's the kind of question you want to ask. Is there any monitoring that I need? And how frequently do I need to have a check-in with any of the providers that are involved? And finally, the opposite. If I decide to stay on what I've got, if I stay on my current treatments, is there anything that I need to do differently? Am I optimized for what I'm currently doing? So these are the kinds of questions that should be asked, and you should be prepared to ask your provider, either a second opinion telemedicine provider or your primary health HTC provider.
That was a really helpful list. And before this last question, I'll just again remind listeners, if you are interested in gene therapy for your hemophilia B, I strongly recommend that you take a look at the Zebra for Care platform, hematology.zebraforcare.com, or follow the links in the program notes for that free self-assessment that could also lead to that second opinion. So, Dr. Fein, before we wrap up, is there anything that we haven't covered with respect to hemophilia B, telemedicine, or anything related that you'd like to share with the listeners?
It's a different era. Year by year, things are improving in terms of access to care and access to telemedicine. Now, our practice has the only nationwide telemedicine hematology coverage, so we can see you anywhere. I think the key is to stay engaged. So my one message is to stay engaged, have that relationship with your provider, whether it's the HTC locally or a telemedicine hematology provider, and stay on top of things, because we know that by being engaged and being a participant in your healthcare, you're going to end up feeling better about things, and you also possibly live longer and better with your disorder.
I think that's a fantastic place to leave it. Stay engaged. Dr. Fein, thank you so much for your time today. It's been a pleasure speaking with you.
My pleasure. Thank you.